The date is 2026-09. This is the Executive Lens. The biggest story today is the Trump administration's move to realign U.S. childhood vaccine recommendations, a shift that could reshape federal public health guidance and trigger immediate political and medical fallout. According to the White House proclamation titled Realigning United States Core Childhood Vaccine Recommendations with Best Practices from Peer Developed Countries, the administration says it is updating federal recommendations to better match what it describes as peer country standards. The document frames the change as a policy correction, not a temporary adjustment, and it places the federal government at the center of a broader debate over how childhood immunization schedules should be set. The White House says the goal is to align U.S. practice with developed country norms. But the proclamation itself does not spell out every downstream implementation detail.
The significance is not just the policy content, but the signal it sends. Federal vaccine recommendations influence doctors, insurers, school systems, and state health agencies, even when states retain their own authority. Any change from the White House can quickly become a practical issue for families and a legal issue for agencies. The administration's framing suggests it wants to present the move as evidence-based and internationally aligned, but it is likely to draw scrutiny from public health officials, pediatric groups, and lawmakers who see childhood vaccine schedules as a settled scientific process rather than a political one. A second major federal action today is the White House announcement titled Promoting Advanced Artificial Intelligence Innovation and Security. The administration says it is pairing AI acceleration with security safeguards, signaling that the federal government wants to push faster adoption while keeping tighter control over risk. The announcement matters because it suggests the White House is treating AI policy as both an economic competitiveness issue and a national security issue, with implications for procurement, regulation, and federal agency planning.
On trade, the White House also issued further adjusting the tariff regimes for imports of aluminum, steel, and copper into the United States. The administration says it is revising tariff treatment for those metals, which could affect manufacturers, importers, and downstream prices. The practical impact will depend on the exact tariff structure and how quickly agencies implement it. Here is the story most people missed. The White House's vaccine proclamation is paired with the broader pattern of executive action today. Health policy, technology policy, and industrial policy are all being advanced through presidential directives rather than waiting for Congress. That is a governance story as much as a policy story. What to watch today? First, whether the Department of Health and Human Services or the CDC issues implementation guidance on the vaccine change. Second, whether industry groups or pediatric organizations respond publicly to the AI and tariff announcements. Third, whether the tariff adjustment prompts any immediate reaction from importers or manufacturers. That is the Executive Lens for 2026-06-09. Sources in the episode notes. Back tomorrow.